Governor Christie.
Thanks.
Thank you.
I appreciate it. Well, good morning, everybody. And Mary Pat and I are just thrilled to be back here. For us, this has been something that we've been involved in since the mid-1990s, when I became involved with a youth substance abuse disorder treatment center in our hometown called Daytop Village, which is in New York, was in New York City as well. And I learned from young men and women about this issue, and when I was in my early 30s. And it's just been an important thing to me and Mary Pat right from the beginning. And so Kerry is actually telling the story completely accurately. I was a little concerned that she was crawling towards me. But I got over that initial concern that would be generated by that and listened. And here's the thing that's most important about this as we talk about what we need to do as a country. There are people all over this country who need help. And there are people like Kerry, fortunately, all over this country who want to provide that help. And we just have to give them the resources and the support that they need to be able to do it. So we know that this crisis is impacting every family and every community in the country. We got more statistics back just this week that over 110,000 people have died of overdose in the last year. 110,000 Americans who lost their lives, of all ages, both genders, all races, all socioeconomic status. These are, I always like to remind people that those 110,000 people are sisters and brothers, their husbands and wives, their sons and daughters, their co-workers, their neighbors, their friends. They're not numbers. They're real people. And despite trying to remind people that all the time and personalize kind of what the devastating cost really is of that, our national leaders just continue to fail to meet the challenge with the urgency that it deserves. And there's no other real way to put it. Now, look, part of this can be explained, by COVID, because we were starting to make progress. And COVID intervened, and it became the all-consuming public health challenge in this country for a period of years. But it's due to more than that, if we're honest with ourselves. It's also due to the continued stigma faced by people who are in the midst of active addiction. Addiction and even overdoses continue to be viewed by people as a personal failing, a result of the lack of willpower or of ignorance or of some character defect. And sometimes we hear people say it explicitly, but often it's just a look. And for people who are in active addiction or for people who are in recovery, they know what I'm talking about. They know the look. And too many of our public policies continue to be funneled through that misperception that this is somehow a character failing, that this is somehow a choice. We have to work on the misperceptions because if we don't get to that, we're never going to get to a place where we can really save lives at a large scale. So, as I said, for nearly 30 years now, I learned about those issues and continue to learn. And Daytop Village was a huge part of my education in that. And a great guy named Father Joe Hennon, who started Daytop Village in New Jersey and made it a place where children could come to be treated. And as governor, I made it my mission to not let, kind of the political view of this rule in our state. And we were all about trying to get barriers out of the way each and every day, not only through the programs we put together, but most importantly about the way we talked about it. and I mean we, um, not just me, but it was a requirement for anybody who's going to work in my administration that they had to learn about this and they had to view it in a much different way. And I didn't care whether you were in the Attorney General's office or whether you were in Human Services or Department of Health or whether you're in the Department of Education, all those places that people wouldn't necessarily, except for the Department of Health, associate with this. But every one of those places runs into it. Every one of them. It's law enforcement, whether it's in our schools, whether it's in all the other human services that we provide, whether it was in the Department of Health, every place we saw it. So we wanted to have a different conversation about addiction in New Jersey and to put care and compassion in the forefront of our language. And because we did that, I think we really became a national leader in that. We passed a bipartisan Overdose Protection Act in 2014, allowing people to call 911 to report a drug overdose without the fear of getting arrested themselves. And let me tell you who called me to advocate for that legislation when it was being considered in the legislature. Look, if you're from New Jersey, there's a few people that you want to get a phone call from, right? One of them is John Bon Jovi. And so one night, Mary Pat will remember this. I was at home, my cell phone rang. It was an unknown number. I answered it, and the person on the phone said, "Governor?" And I said, "Yes." He said, "I got your number from someone that probably shouldn't have given it to me, but they thought that you'd be willing to listen to me." I still didn't know who it was. And I said, "Okay, who is this?" And he said, "This is John Bon Jovi." And John's daughter had just gone through an overdose and had gone through an overdose where there was someone there with her who was using with her. But he called the police when she overdosed and he got arrested. And he said to me, "This law is in the legislature. I don't know if you know too much about it, but I really would hope you would look at it. And if you want to talk to me about it, from my experience with my daughter, I'd be happy to do that." And so that started a relationship back in 2013 that for Mary Pat and I, John and his wife Dorothea and their family have become great friends of ours. And when we signed that legislation in 2014, John was there. And it was so important for him to be there because it goes back to the point of stigma. Here's one of the most successful and best known musical artists in the world. And he was willing to stand up there and admit that his daughter had this problem and that he wasn't just sitting by and trying to hide it. In fact, he was putting it out front with Stephanie and saying, "We want other people to be helped." And John and his family are another part of this journey of how it affects everyone. John's probably one of the richest men in New Jersey and one of the most famous musicians in the country. This addiction doesn't know any boundaries at all. 3 years later, then, we went even farther, enacting one of the country's most comprehensive laws to combat the opioid crisis, limiting initial opioid prescriptions to just a 5-day supply, while mandating that all health insurers in New Jersey cover inpatient and outpatient treatment for drug addiction without prior authorization requirements. And we saw that lead to a revolution in our state for people's ability to access good care. And what it led to, of course, was more care being offered because people knew they were going to get paid and be able to keep their doors open. We were also one of the first states in the country to train and equip police officers and first responders to administer naloxone to overdose victims and made it easier for pharmacies to dispense it without a prescription in our state. So that people didn't have to go to a doctor, they didn't have to ask questions and go through that barrier. They could just go to the pharmacy and ask for it and have it. We increased the number of available beds for the treatment of behavioral health and substance abuse disorders by 40%. And we expanded the behavioral health home model, which is an outpatient healthcare hub that treats not only your substance use disorder, but physical health and mental health in an integrated approach. Because I learned from our friends at the Center for Great Expectations that almost every person who walks through the door has been subject to trauma in their lives, and that their substance use disorder is a symptom of that trauma. And people need to understand that. We also expanded the use of drug courts in New Jersey, giving first-time nonviolent offenders the opportunity to get treatment rather than serving time in jail. And that made a huge difference in our state as well. That change alone reduced the crime rate by 20% and our prison population by 10%. And it allowed me to close 2 state prisons in our state. And I converted one of the state prisons into a dedicated substance use disorder treatment facility, so that for inmates in New Jersey, if they had a verified substance use disorder, they spent the last year of their sentence at this facility rather than the regular jail. And what we would do for them is not only give them the treatment that they needed, but before they left, if they qualified, we would sign them up for Medicaid. Before they left, if they were going to take medication-assisted treatment, if they were taking it in the facility and we wanted to continue on it, they not only got signed up for Medicaid so they could get it, we gave them the list of Medicaid pharmacies that they could go to, and we gave them their first month's prescriptions. All of that increasing the likelihood that they would stay in recovery and get that help. Think about someone walking out of prison, has no money, many of them no family to go to, and how are they supposed to keep their recovery going? So we thought that this would help, and it did. It reduced the recidivism of those folks who went through there by more than 25%. And those are all lives that were saved, that are not back in prison, and we're proud of that. So during my time as governor, those efforts and the efforts of a lot of other governors across the country made some help, but no state can tackle this alone because it's a national problem. It's not just a state problem. And while I declined every other opportunity to work in Donald Trump's administration, and there were many offers, the one I was determined to take on was when the president asked me to chair his commission on combating drug addiction and the opioid crisis in 2017 while I was still governor. I got to select the members of the commission, so we made it bipartisan. Patrick Kennedy, someone who's in active recovery, and a Democrat on our commission. Charlie Baker, the former governor of the neighboring state of Massachusetts, where they've done a lot of really good work on substance use disorder treatment, joined as well as along with others. And we spent 6 months traveling the country to study the issue, talking with people who were facing addiction, and talking to those people who were helping them to recover. And we talked to researchers and other advocates, and we worked to try to understand better the problems that people were facing in accessing care, as well as the ways in which the current laws failed to evolve to meet the crisis as it was getting bigger and bigger. In our final report, we made 56 specific recommendations to the president. And I'll just give you an example of a few of them. An expansion of federal block granting for substance abuse related initiatives tied to specific requirements for data collection and sharing. And Kerry and I were talking about that this morning and how great they're doing here on data collection and how important it is to inform the kind of treatment that we give to people. New professional education standards for opioid prescribers, as well as specific trainings for all medical professionals in identifying and caring for patients that are at risk. It was amazing to me that we give every doctor a prescription pad, but absolutely no training ongoing about the opioid crisis. They could write you as many prescriptions as they wanted, but they didn't know what the impact of that was. And my best example of that was our daughter, who at the time was 18 years old and went to go get her wisdom teeth out. And the oral surgeon gave her a prescription for 30 Percocet. 30 Percocet for wisdom teeth. And she went right from the doctor to the pharmacy to pick them up and brought them home. And I took them and threw them away. And I said, you know, take some Tylenol, hang in there. You'll be good. But think about that. And I called the doctor who we knew. And I said, what the hell are you doing? You have an 18-year-old girl who's going back to college 30 Percocet over Christmas break. Excellent. Whether she uses them or whether maybe her roommate steals them or somebody else knows that she has them and comes into her room and takes them. We're setting up a chain of potential disaster for something that really isn't necessary. And he didn't have any answer for me on the other side. And given that I was governor, he just said, yes, sir. We also advocated for tougher federal sentencing penalties for people who are trafficking in fentanyl, as well as it making it easier for federal agents to detect and intercept it. The jail cells in this country should not be for those who are addicted. They should be for those who are profiting from that addiction. And most importantly, making it easier for people to access care by removing reimbursement and policy barriers to treatment, establishing federal drug courts we recommended, ensuring first responders nationwide, all over the country, have access to naloxone, and allowing for treatment through telemedicine. We recommended this in 2017, not knowing that in 2020, COVID would be coming, and that those recommendations for telemedicine would now not just be advisable, they would be absolutely necessary, or people would get no treatment at all. So there's still a lot of work to do to complete implementing the recommendations of the commission. I'm proud that all 56 of them were endorsed by the Trump administration to Congress, but Congress still has a lot of work to do. Because, what often happens in Washington, our leaders make progress addressing one pressing problem, only to be distracted by the next issue that arises. But the opioid crisis has only gotten worse, not better. In fact, what we've seen in the 6 years since the report was issued was that while we had, right after Congress passed the Support Act, some initial real good progress, and even here in New Hampshire, you had a year or two when addiction overdose deaths went down. But when COVID came, it changed all of that. So in the past 12 months, over 80% of the deaths that I talked about involve fentanyl. And the country's experiencing now an even more dangerous stage of the crisis, because it's bad enough when people know what they're taking. But when they think they're taking one thing, and in fact, what they're doing is taking something that is either completely or laced with fentanyl, they don't even know the danger that they're putting themselves in. The synthetic opioids like fentanyl that come to us via Mexico from China are creating all kinds of new crises. And now, because street drugs, normal street drugs, are being laced with fentanyl, people don't even know what they're going to have to deal with when they're making a deal with someone who is profiting from trying to hurt them. They're calling this now a polysubstance use crisis. I think that's probably too complicated for everybody to deal with. Like, the stuff we think we're getting, we're not getting. And it's making victims of people who are battling addictions, not just to opioids, but to cocaine, to meth, to counterfeit prescriptions, and even animal tranquilizer is now being seen all over our streets. And often that gets laced with fentanyl as well. So it's led to new spikes in the overdoses in our African-American communities, our Latino communities, Native American communities, as well as alarming increases in overdoses among children. So now there's so much work that we need to do to stem the flow of fentanyl into our country. And we've talked about several of those steps, and I'm not going to repeat them all today, as to what we would do to work on the southern border. Because I think that while it's vital to do that, and it will be important to stem some of the flow of this stuff into our country, and we can do that, that's not going to be what's going to fix this problem by itself. And people who say that that's what will do it just are not telling you the truth. They think that kind of this tough talk, I'll shoot them stone cold dead at the border if they have a backpack on. We'll cut off all trade with China if they don't stop sending fentanyl precursors to Mexico. We'll send the United States Army to invade Mexico. Like, all these things will make you feel good on the visceral level. But for people like the people in this room who are experiencing firsthand this crisis, that those things may help about that much. Because the reality is, we don't solve this crisis unless we focus on substance use disorder, and what gets us there and what helps to get people out of it and into recovery. Today, only 10% of Americans with opioid use disorder are accessing treatment. 10%. Improving access to care, as we learned in New Jersey, requires meeting people where they are and providing them with resources they need wherever they are on their journey to recovery. So when I become president, I'm going to direct the DEA to make permanent the flexible telehealth policies for medication-assisted treatment that were put in place during the pandemic. We'll continue telehealth expanding patient access, particularly in rural areas and for patients that are suffering from other disabilities, which make it difficult for them to travel. We have federally qualified health centers all over this country. And they're another part of the resource we should be using. Only 60% of these FQHCs provide any type of medication-assisted treatment. I mean, think about that. We're dealing with people who are going to federally qualified health clinics either because they're uninsured or can't afford some of the co-pays that might be charged to them by the insurance they do have. And only 6 in 10, if they have a substance use disorder, can get any kind of treatment there for that. And for many, that's the only doctor they get to see. So I'm president, FQHCs will be required, all of them will be required, to provide MAT, because we know it's less stigmatizing to receive the treatment where you already access your health care. It will make people more willing, if they're seeing a regular doctor all the time, to talk about their problems and if they have to come and see someone new all the time. And finally, despite there being about 1,900 opioid treatment programs in the country, access can vary, as you know, from state to state, and even within the state, from community to community. As Carrie and I have talked about any number of times about there being welcoming communities and non-welcoming communities for this kind of care. So we're going to establish a federal grant program to create mobile treatment centers that will be able to better access underserved areas. And what we would do is try to induce people like Carrie, who already have a successful model and staff that know how to do this, to expand to make their treatment mobile as well. It would cut down on their capital costs for a beautiful building like this, but also be able to reach more and more people. And the federal government, in my view, should fund that. They can also, support other, reduction interventions like fentanyl test strips and naloxone distribution, and telling people how to navigate all of these different treatment options, and being able to have it roll up into your neighborhood and have you be able to access it, I think will give us even more options for people. And that's all we're looking for, are options so that people can make the decision to try to save their own life. And that's what we want them to do. But we know that you have to be ready. You have to be ready to seek care. You got to be ready to ask for help. And that's why we also have to focus on saving the lives of those who are not yet ready to come in and step up. We have to continue to take action to ensure that naloxone is available at no cost or at only a nominal cost and without prescription all across the country. And what I think we should be doing and would do as president is to require the co-dispensing of naloxone with any high-risk opioid at the pharmacy. If you're going to get an opioid, you should get the naloxone with it so that you have it and you can carry it with you. So that if something happens, either intentionally or unintentionally, the ability to save your life is right there in your pocket, in your glove compartment, in your purse, wherever you would keep it so that it's with you all the time. It's also imperative to improve data sharing, to create a better understanding of the overdose deaths and treatment, to identify core geographical regions where the need is the greatest, because we know that it changes based on demographics across the country. Well, this is one of those 56 recommendations. It still takes 6 months for the CDC to provide accurate overdose data. We've been told for decades that it's just too difficult to more accurately track and understand. But wait a second. During COVID, we were getting information daily on new hospitalizations, new infections, and new deaths, right? We can remember watching CNN or any of the other news stations, and in the bottom corner of the screen, they had the running tab of the information. So if we could do it for COVID, why can't we do it for this? And how great would that be in terms of being able to analyze where the problems are and what the nature of them are, and to increase public awareness of just how devastating this is. I mean, if we keep saying that these things are too hard, what we're saying is that working harder at this is too much, and that the lives that we're losing are not worth it. And I'm sorry, I just don't believe that. I believe every life is a precious gift from God. And no matter what condition you find that life in at any moment, it is still the same precious gift. You know, Republicans say we're the pro-life party. Well, we better be pro-life for the whole life then. Now, if you're pro-life just for the 9 months in the womb, now, well, I have never carried a child for 9 months, so I defer to all of the women in this room who have. I will tell you that I think it gets even more complicated when they come out, right? A lot more complicated. And we need to recognize that a 16-year-old young woman laying drug addicted on the floor of the county lockup is a precious life. That the 35-year-old lawyer who gets addicted to painkillers and is throwing his life away, that's a precious life. That the woman in her 70s suffering from pain from a disease that comes on due to age and winds up becoming addicted to painkillers, that's not the end of life. That life is still precious as well. Those are the challenges that we face. And what I've talked to you about here today, I think are, and I know, are really achievable steps that we can take to save lives and to turn the tide of the epidemic. Yet time and again, we've been let down by our government because they fail to show any sense of urgency. They talk about it, but they don't act. The Support Act, which was a result of what we did in the commission, needed to be reauthorized by the end of September or it was going to expire. Provided a lot of the funds that Kerry's used here and in places all over the country, and Congress let it expire. So since the end of September, now for nearly 3 months, the Support Act has been expired and those funds are not going forward. And it was such an important part of funding community-based treatment and recovery like this program, as well as a lot of other policy reforms, such as requiring state Medicaid programs to cover medication-assisted treatment. That is now stopping. While the reauthorization is there in Congress, it hasn't been passed. And they've made some really good additions and modifications. To me, it's unacceptable that the president has been silent on this. And this is a president, the son, who has experienced addiction. And it would be unacceptable for any president to be silent about this, but it is particularly galling to me. And this is not a political statement or a partisan statement. He owes it to this country as a father who understands the pain that every member of the family goes through when there's someone in active addiction in their family. It's astonishing to me that he's not talking about this, that he's not railing against Congress to get this reauthorized, that he's not making this a top priority. I promise you, if I'm president, I will. And I will because of all the things I've learned over the last 30 years. One of the things that we said in the report 6 years ago was that the president should declare the opioid crisis a national emergency. And he did. And he deserves credit for that. Yet for much of those 6 years, both President Trump and President Biden have treated it as a crisis in name only. And they haven't done everything that they need to do to keep us making progress. And so as a result, if you don't make progress, you're falling backwards. So this is now a test of our national resolve. This is a test to see who we want to be as both a people and as a country. I want to be a president who keeps this issue front and center, who understands the urgent nature of the challenge we face. And we need an approach that remembers and reflects on the very basic humanity of every single one of those 100,000 victims, as well as the treasures that each of them could have brought to this country if we would have given them an opportunity to recover and to put their lives back in order. Millions and millions and millions of people in this country are struggling with that problem every day. And I just don't mean the people in active addiction. I mean their mothers and fathers and their husbands and wives and their sisters and brothers and their sons and daughters who are all traumatized by this problem. We don't even, I think, completely understand the damage that we're causing to generations in this country because we continue to believe that somehow this is a moral failing and not a disease. It is a disease. It is no different than heart disease or cancer or diabetes. Every one of those diseases, every one of them, contains human conduct as part of the cause. I say all the time, my mom is gone 20 years now, and she was an addict. My mother was addicted to nicotine. She started smoking when she was 16 years old in 1948, when everybody thought smoking not only wasn't bad for you, they had commercials saying how good it was for you, how great it would make you feel. And so she started, and she was one of those people who just could never stop. And after 55 years of smoking, she inevitably, after all the stops and starts of nicotine gum and patches and hypnosis and all the different things she went through, she finally got the lung cancer that was inevitable to come her way. And by the time they found it, it had spread throughout her entire body, to her brain, to her kidneys, to her liver. And so by the time she was diagnosed, she lived for only 3 more months. And when she was dying, she said to me, "You know, Chris, the worst part of this is I did it to myself." How many people in this country are living with that guilt because we're not helping them? And by helping them, I mean we're not telling them it's okay to ask for help, that we're not going to judge them if they ask for help, that we're not going to look down on them if they ask for help, but that in fact we're going to embrace them. The same way anyone who has any of those other diseases I mentioned, you never hear people unwilling to say when their loved one had a heart attack, or their loved one has cancer, or their loved one has diabetes. They're not ashamed to tell people, even though that person may have done some things in their life that helped to make that disease exist or make it even worse. But if someone's going through substance use disorder, does the family announce it to friends? Do they ask others for help, or do they try to hide it? And does that shame lead ultimately to those people often not being able to get the help they need to recover? We have so many things at our disposal to help people who have this disease get to the other side and have a pathway day by day by day to deal with their addiction through recovery and through renewing their lives in a brand new way. I can't imagine that being the richest and freest country in the world, that we're not going to focus on this and try to save the people of this country who are suffering. And I think it takes a president who is willing to stand up there and talk just like that and make people in this country understand. And if you don't think it's possible, I'll just remind you of one thing. You know, before Betty Ford, we didn't talk about addiction in any way, and we didn't talk about breast cancer either. And yet Betty Ford, when she was First Lady in the White House, spoke both about her breast cancer struggle, her surgery, her treatment, and made it okay for women to talk about it and to advocate for themselves and for better and more available treatment for breast cancer. And at the same time, she admitted that she was dealing with addiction to alcohol. And she opened up her own treatment center, which still exists today, and set a whole new tone in this country for dealing with these things. It can be done. And the White House is the greatest megaphone in the world to advocate for these type of things. And that's exactly what I would intend to do starting in January of 2025 if I'm elected president. And the lives that will be saved will not be only a gift to those individual family members and friends who don't want to sit at that funeral and realize that maybe they could have done more. It's going to be a gift to the country because we never know what's possible for the people who are in the midst of this and what their lives could be. I'll end with this, that I met a young man at Daytop Village when I first got associated with it. And he was a 15-year-old heroin addict who had been abused by his parents and had fallen into addiction and had nearly died twice. And I went there and met with him along with a group of other folks who were in treatment at that time. And I was a private practice lawyer in New Jersey. I had no public position of any kind, but was just there to try to be helpful and supportive. And he told me when he was 15 that one of the reasons he was as upset as he was because he had always wanted to go to college and go to law school and be a lawyer like me. I didn't keep in touch with him after that because it's a residential program. He was there for a year and he left. Years later, something he could have never known, I became U.S. attorney. And one day I got a resume that came across my desk. And the name looked familiar to me. It was for our internship program for law students. And I called Father Hennon at Daytop and I said, here's this name of this guy, this resume I just got. Is this guy one of the people who was a patient at Daytop? And he said, oh yeah, I didn't tell you about him. He said, after he got out of the program, he got his GED and then he got a job and he went to Rutgers at night and now he's in law school. So I called him in and he said, I didn't think you'd remember me. And I said, well, I just kind of remembered your name. I said, but you're hired. And he came to work as an intern at the U.S. Attorney's Office. And he's now a private practice lawyer in New York City at one of the biggest law firms in the city. A 15-year-old young man who nearly died twice, abused by his parents, who I think most people would have looked at 15 years old and thought he was unlikely to live, let alone accomplish what he accomplished. My point to you is that we don't know. We don't know what's inside ourselves and what we're capable of. We don't know what's inside of the people that we love and what they're capable of until we give them a chance. And by doing this, we can give them a chance. And I think it's not only a great opportunity, I think it's a moral obligation for us to do it. And I hear everybody talking about the border, and we have to. Everybody talking about law enforcement. I did it. Unlike the other people in this race who've never done it, I did it. I can guarantee you we're not going to arrest our way out of this problem. The way we're going to fix this problem is to reach our hand out and tell people it's okay to ask for help and then to give them that help that they need. We're not going to save every life, but every life we save is a gift. And as president, I intend to make that happen. So I'm happy to be back here. I can't believe, really, Kerry, when we think about where you were 8 years ago and what this place was 8 years ago and what we're standing in the midst of today, it will tell you that one person who cares deeply about something can change the world. And she has. And of course, she's brought lots of people along with her that have helped her to do it. But without her, it wouldn't have happened. It has to start with someone. That's what leadership is. Leadership is about inspiring others to follow and to help and to be a part of the solution. And when I look at this place and the other facilities that you have in this city, it is an absolute testimony to the power of moral leadership. Leadership that's based not on personal gain, but leadership that's based on helping others, on working on something bigger than your own self-interest. And that's what she's done ever since she was crawling through those tables to come and see me. Maybe not the most elegant start to our relationship, but one that I know Mary Pat and I are really happy that we still have 8 years later. And I thank you all for coming this morning, listening, but more importantly, I thank you for what you're doing. Whether you're someone who's currently in recovery, I thank you every day for doing what you do to get to the next day. And if you're someone who's a family member of those people, I thank you for your strength and your love for those folks. And know that it's unconditional. And for those who work here, I thank you for doing what you're doing every day to help save lives. And for those of you who support the work here with your labors or your financial support, you are doing great things for people that you may never meet and certainly will never know well. But know that what you're doing is an extraordinary, extraordinary gift to this community and to our country. So thank you all for being here, for participating the way you do. I appreciate it.
Thank you so much.
Okay.
Thank you.
Really great.
Really,
really great.
Thank you. Are you taking questions? I don't know if
I don't know. Am I?
I have 3. I want to
Sure.
thank you again. I want to.
I'm happy to.
Especially for your policy and for keeping this front and center. And if you wanted to invite the group, if you do go to the White House, we would be happy to go to that. And then the other thing was
Carrie's angling for that Lincoln bedroom overnight.
We have a gala March 23rd, 2024. If you want to get me in touch with John Bon Jovi, that would be great.
That would be good.
And then it is not SUD related. I have said the other thing that I'm going to ask every candidate for the rest of this time and for this season is, if you're elected to president, I'm going to ask this to all candidates, what are you going to do about daylight savings time? Because it really affects mothers in huge ways.
Yeah, see, Mary Pat will tell you, I'm not a fan of winter and I'm not a fan of the dark. And so, yeah, I think you know what I would do.
Okay.
All right. Being not a fan of winter or the dark, I think you know what I would do. Yeah, but I'm happy to take a couple of questions if people want to ask. Yes, ma'am. Hi, Cora.
She's awesome.
I'm very fortunate. I get to live down the street from Carrie often. One of the biggest barriers we're facing right now is childcare. Right now, we're going through a market failure, and between watching my staff watch children have to leave because parents can't afford to pay, people working within the field are not being paid enough as well. On a New Hampshire level, we spend a lot of money into childcare, $6.5 million for the scholarship system, $15 million for the workforce. On a federal level, what would you do for childcare?
Yeah, look, I think it has to be a part of the package I just talked about, because you can't, and that's why I pointed to the Center for Great Expectations model to Kerry, because what's there is they start when mothers are expecting and are in active addiction. So they're treating them, they take them through childbirth and through child care. And we have to see all this as a continuum of care. You can't isolate it. And because one of those pieces comes missing, the rest of it all falls apart. So to me, it would be part of the block granting that I talked about. And then give it to governors, because I really do think when you watch what Governor Sununu has done here, he's done really good work in this area, and he knows it better in New Hampshire than I would know it as president. And being a governor, I know that I know New Jersey better than anybody in Washington knows it. And if you give governors the ability to have that money from the federal government and then to use it the way their state needs it the most. Now, in some instances, they have enough to deal with parts of this problem in their own state budget, but in others, there are holes. So let them make that decision. So to me, childcare would be a part of that block granting issue and allow them to use it on that if they feel like that's where there's a desperate need in their state at the moment. So I would turn that over to governors to make that decision, but give them increased funding and a block grant for them to decide exactly how they want to use it. Because, as president, I'm going to come back here because Kerry will make me. But I won't be here as often as Governor Sununu could be here. And you won't see me as much as you might see him and be able to impact what he's doing. And that's why I think giving the money to them in a way where they get to decide allows you to have influence on them on how they decide. Try to have influence on how they decide in Washington. Forget it. There's no chance you're going to be able to get to do that. So that's why I would do it that way. And I think it's an incredibly important piece of it, because if you have mothers or fathers who are in recovery and are trying to deal with that and deal with supporting themselves, but can't get affordable childcare, one of those two things or both are going to fall off as well. They're either not going to be able to work anymore, and or they're going to be so despondent over that failure that it's going to push them right back into active addiction. And so we can't leave that piece out. So I'm glad you're doing what you're doing. Other questions? Yes, ma'am.
Hi, I am a resident of Abby's Place, and thank you for your time today. It was really nice. What do you plan on doing about housing, expanding housing for eligible parents, moms with children? Because we're only a limited time here at Abby's Place, so that sets a huge barrier for if we are on current housing lists, wait lists, which tend to exceed our time here at the transitional housing. I know the staff here won't kick us out on the streets. I know that. So I know but just given the fact that mothers with children, it's we want to have stability with our children.
Yeah,
so,
you need it and the children need it.
absolutely.
And I'm seeing it all over the country. Look, that's why this has to be a whole of government approach, like I mentioned off the top about, when I was governor, having all of those different areas have to be understanding that this is a priority issue, right? So in this instance, as president, we would revamp the way the Department of Housing and Urban Development distributes that money to put a focus on this. There's a lot of old legacy programs there that just aren't relevant anymore, or at least not as relevant as what we're dealing with in this crisis. And so what I would do is appoint a Secretary of Housing and Urban Development and say to him, like I said to my Commissioner of Human Services, who provided that type of support, and our Commissioner of Community Affairs in New Jersey, who dealt with housing. I said to both of them, you have to figure out a way to start to deal with this housing issue inside our own state. And in those, we were dealing with people who are in recovery and the developmentally disabled. Those were the two areas where we had real crisis on housing in New Jersey when I became governor, and what we then started to focus on. So you have to make it a focus for those folks and change some of those old legacy programs, which just aren't as necessary anymore. Now, look, when you do that, you're going to take some people off, because there still are some people in those old legacy programs, but government has to move on to the crises. First, you've got to deal with the crises. And I think the way to deal with that is to reallocate the funding that we have in housing right now and reallocate it much more to deal with those two, because I see both those groups are still a huge problem across the whole country. Those who are in recovery and those who have developmental disabilities, because those people, in my view, should not be institutionalized. They can live and do well in the community. And for our folks who are in recovery, they need to be in the community. One, to take care of their children and make sure their children are educated. And two, for them to have the interaction they need to keep their recovery strong. And so that's the way I would deal with that. Thanks. Yes, sir.
I was lucky enough to be one of those that testified at the commission in Washington. And I'm wondering, I didn't hear you mention prevention. How do you do prevent all this, the youth?
Well, look, I think that starts with families, and not with government. And so I think that there's got to be more discussion, and we need to foster that discussion by the way we talk about it inside families about the dangers of these choices that get made. The other part of it too is for us to be talking about it much more than we talk about it in schools, and in a much different way than we do right now. My view is that what we should be doing is to be talking to kids, um, and letting them know, especially those who have a family history, that matters. That if there's history in your family of addiction of any kind, that you are more prone to it, and you have to be even more careful. I don't think we talk about that nearly enough in our schools. That every kid thinks they're brand new issue, But unfortunately, we not only pass on the good things about us, we pass on some of our weaknesses too. And some of those weaknesses can be physical and some of them can be psychological. And we need to be talking about that. I think the schools is the place that have to partner with parents to be able to have those conversations. Because I think the only way to actively prevent is awareness, right? There's no physical way to prevent somebody from doing something, but awareness is what will do it. And I think having parents be inspired by a president who's willing to talk about this and urges them, and I would urge parents to have conversations with their kids about this, as uncomfortable as it is, and then also to make sure that schools are talking to them about the risk factors for addiction. How, look, I can tell you that one of the things that really impacted me at a young age was when Len Bias was killed, taking cocaine for the first time. Like before that, I think most people felt like you couldn't, if it's first time, it's first time, right? Like nothing bad's going to happen to me. But what we need to know is that everyone gets addicted at a different pace. And sometimes it's the first use that makes people an addict, especially if they're prone to that because of their genetic background. So I think the awareness issue is really important. And also, we need parents of tragedy to be speaking out too. And I think some of the most compelling talks that I heard in front of the commission were from parents who had lost their children and how they missed some of the signs and the guilt that they felt from that. How their child may have been reaching out for help, but they didn't recognize it until it was too late. How nobody in the schools spotted that their child had some of these co-occurring issues like depression and isolation. Right. And that's why I made the changes I made in New Jersey, which now requires inpatient and outpatient treatment to be covered by insurance without pre-authorization. I mean, when you're in the midst of this, do you really think to call Blue Cross and say, I'd like to have pre-authorization? I just reversed my son or my daughter on naloxone. They're laying in an emergency room, and we need to get them into treatment. I need to get them tonight because he's ready tonight after having gone through that experience. They go, oh, well, it'll be 7 days until we can review this for pre-authorization. And by the time that happens, he or she is like, I'm fine. I'm better. I'm not an addict. I don't want to go to treatment. I'm done. So those things are practical things that add to the toolbox that a parent has, if they spot the signs. But I think those talks from parents and giving them a spotlight, not only nationally, but state by state, is a really important thing to encourage as well. So the last thing we got to remember is, in some respects, it's a mystery. And I've spoken to a lot of parents over the time that I was chairing the commission and while I was governor, who lost their children and really in their heart, saw no signs that it was going to happen. And so that needs to be communicated too, that you can't wait to see something, that you have to expect it could happen and try to talk to your kids about it beforehand. And so all those things I think are really important, and they're an important piece of this. But when we have 110,000 people dying in the last year my focus is going to be on making sure that those people get treated before they die. And if the families and the local educators can work on the prevention part, and I'm sure that we can provide some money to help with that, but I think more than anything else, it's not a money issue. It's an awareness issue and a lack of shame issue. Like, can't forget how big stigma is in this. They don't want to talk about it because they think, God, am I giving them ideas? My experience is they don't need any ideas. Ideas they got plenty of. They're not going to go, oh, yeah, maybe I will take drugs because my father just talked to me about it. Yeah, it's unlikely. It's unlikely that's going to be the cause or the spur. So we got to be aware of all that. All right, anything else? Yeah.
So you mentioned pre-authorization not being a thing in New Jersey at this point. Is that something you would implement across the nation?
Yes.
Because right now, prior authorization for our clients is unique.
Yeah. And it worked in New Jersey. I mean, like the insurance companies didn't go out of business. They're still making money. They're doing okay. And I expect that they'll continue to, because that's their job, is to figure out how to do okay, how to charge us enough so that they do okay and provide us the services. And I just, when I would talk to the leaders in the health insurance industry in New Jersey when I was getting ready to do this, and they were trying to urge me not to, I would say to them all the time, well, what are you worried about? Like, you think people go in there faking it? You think somebody wants to go into treatment for the heck of it? I'd like to give it a try. If you think that, you've never been in there and seen what people go through, because this is no picnic, and it is hard, and it forces self-examination if you want to be successful in a way that most people have never done in their lives, and that's painful. So yeah, there's no doubt that my view would be this should be a national, an absolutely national requirement of the insurance industry, because if they don't do that, then you're going to get people tied up into knots. And we know there's a moment for most people when they're willing to go into treatment, but it usually isn't a whole lot longer than a moment, at least initially. And so you got to seize that moment. One of the things we did in New Jersey too, that I mentioned this morning, was we funded recovery coaches in every emergency room in New Jersey. And 95% of these people were folks who were in recovery themselves. So that when someone came to after a naloxone reversal, the first person they saw was a recovery coach who was laying out for them where they could go for treatment, why it was the right thing to do, and was speaking about it from a personal perspective. I've been through this. I've been laying on the gurney you're laying on. And I know there's a path to get here where I am now with a white lab coat on helping you. And it wasn't, and the reason I know it still is a great program is that my successor has kept it in place. Usually when the new person comes in, they reverse everything you did because they're right and you're wrong, right? This is the way it goes. But this one, they haven't. So I think it's another issue that we need to deal with across the whole country, is recovery coaches can make an enormous difference for people in providing that access to care and making them willing to consider it and to move in to doing it. So I think those things are really important. But if you don't get rid of the pre-authorization problem, the recovery coach is required to say, and I'll see you in 7 to 14 days to talk to you more about what recovery center you might be able to go into. That person may be dead the next 7 to 14 days. That person may be out of the area in the next 7 to 14 days because they've gotten kicked out of their house or they voluntarily left home because of their addiction. We know, we've seen what those things are like. So one of the things that made the recovery coach system successful was the elimination of the pre-authorization, because they could do it right then. We would have an active database of beds available in treatment centers in the regions of the state, and they could access that and call and say, can you take this person tonight? And that's when we know we have the best opportunity for success. When you're scared to death, that's when you're most open to a solution. When you get 12 hours away from I've seen this and spoken to doctors and recovery coaches who say, like, most of the time, if we don't get them in the first 12 hours, they're gone. They check themselves out and they go. And the next time we see them is when we have to reverse them the next time. I had one recovery coach tell me that he finally got a guy to treatment. The 6th time he had overdosed and been reversed. And when he came to after the 6th one, and the same recovery coach was standing there, he said to him, you know, in craps, 7 is typically unlucky. And I don't think you're going to make it the next time. And he finally convinced the guy to go into recovery. So those things are all really important, and pre-authorization is a big part of it. And I don't see any reason. They can all go to the profit and loss statements of the health insurance companies in New Jersey. They're all doing just fine. And it's been, you know, that was 2016. So it's been 7 years. None of them got out of business. They're all doing okay. So thank you all for having me this morning. Thank you for your questions. Thank you. But more importantly, for those of you, and I think everybody in here has something to do with this place and with this issue, like, don't give up. Don't give up. There are a lot of people out here who love you and care about you and want you to recover. And a lot of people who honor the folks who are helping to support your recovery. And I'm one of them. So thank you very much. I appreciate it. Thanks, Kara.
Thank you.
You're doing great.